Autism, or Autism Spectrum Disorder, ASD. It is a neurological and developmental disorder that begins early in childhood and lasts throughout life. Autism refers to a broad range of conditions. The term spectrum in autism spectrum disorder refers to the wide range of symptoms and severity. It is characterized by challenges with 1. Social skills, 2. Repetitive behaviors, 3. Speech, and 4. Nonverbal communication. People with autism have trouble with communication. They have trouble understanding what other people think and feel. This makes it hard for them to express themselves, either with words or through gestures, facial expressions, and touch. People with autism might have problems with learning. Their skills might develop unevenly. For example, they could have trouble communicating but be unusually good at art, music, math, or memory. Because of this, they might do especially well on tests of analysis or problem solving. There is not just one autism condition, but many subtypes. They are influenced by a combination of genetic and environmental factors. Each person with autism has a distinct set of strengths and challenges. Some people with ASD may require significant support in their daily lives. Others may need less support and, in some cases, live entirely independent. Autism is accompanied by the following issues. 1. Sensory sensitivities and medical issues such as gastrointestinal, GI disorders. 2. Seizures or sleep disorders. 3. Mental health challenges such as anxiety, depression, and attention issues. Signs of autism usually appear by age 2 or 3. Many children who don't have autism show a few similar signs. That's why a professional evaluation is crucial to diagnose autism. Diagnosing ASD can be difficult since there is no medical test, like a blood test, to diagnose the disorders. Some of the signs or symptoms. By 6 months, few or no big smiles or other warm, joyful, and engaging expressions. Limited or no eye contact. By 9 months, little or no back and forth sharing of sounds, smiles, or other facial expressions. By 12 months, little or no babbling. Little or no back and forth gestures such as pointing, showing, reaching, or waving. Little or no response to name. By 16 months, very few or no words. By 24 months, very few or no meaningful, two-word phrases, not including imitating or repeating. At any age. Loss of previously acquired speech, babbling, or social skills. Avoidance of eye contact. Persistent preference for solitude. Difficulty understanding other people's feelings. Delayed language development. Persistent repetition of words or phrases, echolalia. Resistance to minor changes in routine or surroundings. Restricted interests. Repetitive behaviors, flapping, rocking, spinning, etc. Unusual and intense reactions to sounds, smells, tastes, textures, lights, and/or colors. All autism disorders were merged under one umbrella diagnosis of ASD. Previously, they were recognized as distinct subtypes. 1. Autistic disorder. This is what most people think of when they hear the word autism. It refers to problems with social interactions, communication, and play in children younger than 3 years. 2. Childhood disintegrative disorder. These children have typical development for at least 2 years. Then they lose some or most of their communication and social skills. 3. Pervasive developmental disorder not otherwise specified, PDD-NOS, or atypical autism. Doctor might use this term if your child has some autistic behavior, like delays in social and communication skills, but doesn't fit into any other category. 4. Asperger's syndrome. These children don't have a problem with language. In fact, they tend to score in the average or above average range on intelligence tests. But they have social problems and a narrow scope of interests. There are 2 domains where people with ASD must show persistent deficits. They include 1. Persistent social communication and social interaction. 2. Restricted and repetitive patterns of behavior autism. Statistics identify around 1 in 68 American children as on the autism spectrum. It is a tenfold increase in prevalence in 40 years. Studies also show that autism is 4 to 5 times more common among boys than girls. An estimated 1 out of 42 boys and 1 in 189 girls are diagnosed with autism in the United States. Research has identified more than 100 autism risk genes. However, most cases involve a complex and variable combination. It is both of genetic risk and environmental factors that influence early brain development. In the presence of genetic predisposition to autism, environmental influences increase an individual's risk. It could stem from problems in parts of your brain that interpret sensory input and process language. Genetics. Several different genes appear to be involved in autism spectrum disorder. ASD can be associated with a genetic disorder, such as Rett syndrome or Fragile X syndrome. For other children, genetic changes, mutations, may increase the risk of autism spectrum disorder. Some other genes may affect 1. Brain development, or 2. The way that brain cells communicate, or 3. Determine the severity of symptoms. Some genetic mutations seem to be inherited, while others occur spontaneously. A child with an older parent has a higher risk of autism. Pregnant women who are exposed to certain drugs or chemicals, like alcohol or anti-seizure medications, are more likely to have autistic children. Other risk factors include maternal metabolic conditions such as diabetes and obesity.
Autism. Research has also linked autism to untreated phenylketonuria, also called PKU, and rubella, German measles. PKU is a metabolic disorder caused by the absence of an enzyme. Environmental factors. Researchers are exploring whether factors such as viral infections, medications, complications during pregnancy, or air pollutants play a role in triggering autism. What are the symptoms of autism? Autism affects the way an individual perceives the world. It makes communication and social interaction different from those without autism. It often leads to significant difficulties. ASD is characterized by 1. Social interaction challenges, 2. Communication difficulties, and 3. A tendency to engage in repetitive behaviors. However, symptoms and their severity vary widely across these 3 core areas. Social symptoms. Individuals with autism tend to have difficulty interpreting what others are thinking and feeling. Subtle social cues such as eye rolling, shoulder shrugging, or a grimace may convey little meaning to some. Without this ability to accurately interpret gestures and facial expressions, the social world can seem bewildering. Many people with autism have similar difficulty seeing things from another person's perspective. This, in turn, can interfere with the ability to predict or understand another person's actions. It is also common, but not universal, for those with autism to have difficulty regulating emotions. Communication difficulties. At an early age, many children with autism experience significant language delays. Some exhibit only slight delays or even develop precocious language and unusually large vocabularies. Yet they may have difficulty sustaining conversations. Some children and adults with autism tend to carry on monologues on a favorite subject, but they may give others little chance to comment. In other words, the ordinary give and take of conversation is difficult. Repetitive behaviors. Repetitive behaviors. Unusual repetitive behaviors and/or a tendency to engage in a restricted range of activities are another core symptom of autism. Some repetitive behaviors include arranging and rearranging objects or hand flapping. Some people with autism are preoccupied with having household or other objects in a fixed order or place. It can prove extremely upsetting if something or someone disrupts the order. Many need and demand strict consistency in their environment and daily routine. Slight changes can be exceedingly stressful and lead to outbursts. Repetitive behaviors can also take the form of intense preoccupations or obsessions. These extreme interests can prove all the more unusual for their 1. Content, for example machines, certain collectibles, or 2. Depth of knowledge, For example, knowing and repeating astonishingly detailed information about astronomy. Adults with autism may develop tremendous interest in numbers, symbols, dates or science topics. They can be a great asset in some circumstances, when harnessed in a productive way. Executive functioning and theory of mind. Individuals with autism often face challenges related to their ability to interpret certain social cues and skills. They may have difficulty processing large amounts of information and relating to others. Two core terms relating to these challenges are executive functioning and theory of mind. Executive functioning includes skills such as 1. Organizing, 2. Planning, 3. Sustaining attention and 4. Inhibiting inappropriate responses. Difficulties in this area can manifest themselves in many different ways. Some may pay attention to minor details, but struggle how these details fit into a bigger picture. Others have difficulty with complex thinking, like things that requires holding more than one train of thought simultaneously. Others have difficulty maintaining their attention or organizing their thoughts and actions. Individuals with autism often face challenges using skills related to executive functioning like 1. Planning, 2. Sequencing and 3. Self-regulation. Theory of mind can be summed up as a person's ability to understand and identify 1. Thoughts, 2. Feelings and 3. Intentions of others. Mind blindness. Individuals with autism can encounter degrees of difficulty recognizing and processing the feelings of others. It is sometimes referred to as mind blindness. As a result, people with autism may not realize if another person's behaviors are intentional or unintentional. This challenge often leads others to falsely believe that the individual does not show empathy or understand them. This can create great difficulty in social situations. Many children and adults diagnosed with autism have additional medical issues. They include epilepsy, sleep dysfunction, gastrointestinal disorders or genetic disorders like Fragile X syndrome. As an adult, you may not have experienced these conditions that often arise at a very young age. They may also have a variety of psychiatric and mental health challenges. Some research suggests that autism shares a genetic basis with several major psychiatric disorders. 1. Attention deficit and hyperactivity disorder, ADHD. 2. Depression, 3. Bipolar disorder, 4. Anxiety and 5. Schizophrenia. Recent studies suggest that 30% of individuals with autism struggle with an anxiety disorder. They include social phobia, separation anxiety, panic disorder and specific phobias. Attention deficit hyperactivity disorder ADHD. Symptoms of hyperactivity may include 1. Fidgeting and squirming. 2. Difficulty with quiet tasks or activities. 3. And trouble sitting still during meals, class or other activities. Impulsivity, a third hallmark of ADHD, can cause an individual to be 1. Very impatient. 2. Blurt out inappropriate comments. 3. Act without regard to consequences and 4. Had difficulty showing his or her emotions without restraint. Depression/bipolar disorder. Individuals with autism may be particularly prone to depression in adolescence and adulthood. Bipolar disorder. Among individuals with autism, the symptoms of bipolar disorder commonly include A. Abrupt increases in pressured speech. B. Pacing. C. Impulsivity. Obsessive-compulsive disorder. A distinguishing hallmark of OCD is that the compulsive thoughts or behavior cause anxiety. By contrast, persons with autism are not generally bothered by their repetitive behaviors and restricted interests, but they tend to bring them comfort and enjoyment. Sensory integration dysfunction. Many individuals with autism experience unusual responses to sensory stimuli or input. It is due to difficulty in processing and integrating sensory information. How is autism treated? There's no cure for autism, but early treatment can make a big difference in development for a child with autism. Autism is often treated differently in adults than in children. Applied behavior analysis, ABA, verbal behavior therapy and cognitive behavior therapy, CBT. Behavioral and communication therapy to help with structure and organization. Applied behavior analysis, ABA, is one of these treatments. It promotes positive behavior and discourages negative behavior. Occupational therapy can help with life skills like dressing, eating, and relating to people. These are just a few of the therapies out there that are used to treat children on the spectrum, and in some cases adults. These treatments involve 1. Focusing on the principles that explain how learning takes place and 2. Teaching children as young as 2 the basics of communication and social interaction. Autism spectrum disorder affects children of all races and nationalities, but certain factors increase a child's risk. Sex: boys are about 4 times more likely to develop autism spectrum disorder than girls are. Family history. Family history: families who have one child with autism have an increased risk of having another child with the disorder. Parents or relatives of a child with autism spectrum disorder may too have minor problems. Issues related to social or communication skills or to engage in certain behaviors. Children with certain medical conditions have a higher risk of autism spectrum disorder or autism-like symptoms. Examples include Fragile X syndrome, an inherited disorder that causes intellectual problems. Tuberous sclerosis, a condition in which benign tumors develop in the brain. And Rett syndrome, a genetic condition occurring almost exclusively in girls. It causes slowing of head growth, intellectual disability and loss of purposeful hand use. Babies born before 26 weeks of gestation may have a greater risk of autism spectrum disorder. There may be a connection between children born to older parents and autism spectrum disorder. Most scientists agree that genes are one of the risk factors to develop ASD. Children who have a sibling with ASD are at a higher risk of also having ASD. Taken during pregnancy, drugs valproic acid and thalidomide have been linked with a higher risk of ASD. There is some evidence that the critical period for developing ASD occurs before, during, and immediately after birth. Economic costs. The total costs per year for children with ASD in the United States are estimated. It is between $11.5 billion to $60.9 billion for medical care to special education to lost parental productivity. Children and adolescents with ASD at average extra medical expenditures by $4,110 $6,200 per year. On average, medical expenditures for children and adolescents with ASD were 4.1 to 6.2 times greater. Differences in median expenditures ranged from $2,240 to $3,360 per year. Median expenditures were 8.4 to 9.5 times greater. Average annual medical costs were $10,709 per child, compared to costs for children without ASD, $1,812. Intensive behavioral interventions for children with ASD cost $40,000 to $60,000 per child per year.